Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the Med Edit Podcast.
Well, hello, my friend. Are you excited about our episode today?
Absolutely. We have our favorite dermatologist on today, Dr. Ashley Sturgeon, to talk all things skin cancer. And then one of my favorite topics yet, her top skincare products or treatments.
Yes, I know we both rely on Ashley for our skincare needs, and she has already saved me by removing a precancerous lesion from one of the weirdest places ever, my toe.
Okay, that is terrifying. Identifying the signs of skin cancer, but more importantly, discussing how to prevent it is an extremely important topic, considering 1 in 5 Americans will develop skin cancer by the age of 70. I did not know this, but having 5 or more sunburns in your life actually doubles your risk for melanoma.
Yeah, that is really crazy. Skin cancer is actually the most common cancer in the US, and roughly during this episode, 2 people will die from skin cancer in our country.
Oh, wow. But don't worry, after we discuss this very important topic, we'll switch gears to cover Dr. Ashley Sturgeon's favorite skincare products. Everybody's been asking us about those recommendations.
I know. It's one of our most requested segments. And I think I can guess some of them, but I can't wait to hear them all again.
9,500 people in the United States are diagnosed with skin cancer every day. Let's talk about how to prevent it and how to identify it.
I wish Dr. Sturgeon was going to tell us about the Fountain of Youth. Spoiler alert, she won't, but we'll get close with her top 5 skincare products. Let's go.
We are so thankful to have Dr. Ashley Sturgeon on the show today. She's a board-certified dermatologist who's fellowship trained and board-certified in Mohs surgery, which we'll talk about what that means later. She runs a busy practice at Dermatology Associates of West Texas, and she is the surgical director at the Texas Tech School of Medicine Department of Dermatology. Welcome to the Med Edit Podcast, Ashley.
Thank you.
We are so excited to have you, Ashley. We just love hanging out with you in general, but also I can't wait to talk about skin cancer, especially after my own little scare. All right, Ashley, let's talk facts. How common is skin cancer, and what does this term skin cancer even mean?
So there are several different types of skin cancer. Classically, they're broken down into melanoma and non-melanoma skin cancers. Non-melanoma skin cancers include basal cell carcinoma and squamous cell carcinoma. Basal cell is the most common cancer in the world. Melanoma is another type of skin cancer, and it's the one that people worry about the most. It is actually less common, fortunately. Other more rare types exist and have generated media attention, such as Jimmy Buffett, who recently lost his battle with Merkel cell carcinoma, very uncommon type of skin cancer. Research estimates that non-melanoma skin cancer affects more than 3 million Americans a year, and more than 1 million Americans are living with melanoma.
That is a lot of people. And in fact, I actually know somebody else who had Merkel cell carcinoma recently too. And so it was very complicated diagnosis, and he had no idea. And it was a metastatic situation. So it's crazy that the skin cancer is so prevalent and it can be so dangerous and life-threatening. But we need to talk about who gets skin cancer. Is it just fair-skinned people, or is it more common in men or women? Let's break it down further.
So skin cancer can affect anyone regardless of skin color, but the incidence of skin cancer among non-Hispanic white individuals is almost 30 times higher than that among Black or Asian individuals. Skin cancer in patients with darker skin tones, though, is usually diagnosed in later stages when it's more difficult to treat, and they tend to get it in areas that are not as exposed to the sun, like the palms of the hands or soles of the feet. Skin cancer rates are higher in women than in men before age 50, but are higher in men after age 50, which is probably related to differences in recreation and work-related UV exposure.
Interesting. I think a lot of people think that darker skin individuals can't get skin cancer. So it is important to know that they can. And unfortunately, like you mentioned, sometimes because of that myth, they are diagnosed later, which is, more severe disease, harder to treat. What are some of the risk factors for skin cancer?
Well, there are a few. These predominantly includes excess exposure to UV radiation from sunlight or indoor tanning, which increases the risk for all skin cancer types. But most melanomas are attributable to UV exposure. Women younger than 30 are 6 times more likely to develop melanoma if they tan indoors. As you mentioned earlier, sunburns during childhood or adolescence increase the odds of developing melanoma later in life. Basically, the things that can increase your risks are skin that burns easily, blonde or red hair, a history of excessive sun exposure, including sunburns, tanning bed use, a weakened immune system, and a history of skin cancer.
Okay, that is scary. I mean, a lot of women our age have spent their youth in tanning beds or sun worshiping. It's outside for sure. I also think about when I'm putting sunscreen on my little one, who's very fair skinned, a little blondie. I think about it more for the immediate effect, like, oh, I just don't want him to get a burn and be crying later and in pain. But really, I need to be thinking it more that I need to be putting on this him to reduce his risk of these repeated sunburns for increasing his risk of skin cancer later in life. And that's just something you don't think about as much with your own kids. You sit there thinking, well, I don't want them to get burned, or, oh, they'll probably be fine. It's, cloudy outside. Even if they get a tiny little burn, it'd be okay. But really, you've got to think the big picture that all of this stuff really does add up. But besides living under an umbrella dressed head to toe, what are some preventative strategies?
It does seem like that's the answer, but we do encourage everyone to stay out of the indoor tanning beds, especially, and then protect their skin outdoors. I think that we need to create a culture of sun protection that's second nature, like putting on a seatbelt. This includes seeking shade, wearing protective clothing, including a long sleeve shirt, pants, a wide brimmed hat, sunglasses with UV protection. Also, I recommend that patients apply a broad spectrum water resistant sunscreen with SPF 30 or higher to all of the skin that's not covered by clothing. Some clothing doesn't protect too much either. A plain white cotton t-shirt has only like an SPF of 5, so you can get sun even through that. For more effective sun protection, I love clothing with the UV protection factor number on the label.
Interesting. Yeah, all great advice. And being that fair skinned person, I absolutely do all of those things, mostly because I hate being sunburned. But I'm going to raise my hand right now. I was one of those misguided youth who spent a lot of time in tanning beds because I wanted to be tan like all my friends. Probably explains my precancerous toe lesion as women my age. I mean, the tanning bed epidemic got so bad that starting in 2013, they made it so minors could no longer tan in tanning beds, which is crazy because that was me. I mean, the use of tanning beds before age 18 increases the risk of melanoma by 85%. Fortunately, I wised up in my 20s and started getting much better about sunscreen and clothing coverage. Now, Ashley, how do you identify a concerning lesion that you need to make sure your doctor takes a look at?
So basal cell can look kind of like an acne bump. I'll have patients come in and say, oh, that was just a pimple that didn't go away. It will have kind of a pearly look to it. They're usually unnoticed by patients. I would say most patients don't realize that they have a basal cell. It's usually me who finds it on a routine skin check. I always tell people that if you notice a pimple that doesn't go away in a month, it needs to be seen, likely not a pimple. Squamous cell is a thick, scaly patch that may bleed. Some people think it's a wart or a wound that won't heal. Those can be quite chronic and come from precancerous growths that seem just like a piece of dry skin that doesn't ever go away. A melanoma is usually brown. Most moles are not cancer, but if you have one that's changing, asymmetrical, uneven borders, difference in the color, then you need to have it checked. So we call those like the ABCDs of melanoma: asymmetric, different on one side than the other, uneven borders, difference in color, and then diameter greater than 6 millimeters, which is the size of a pencil eraser. So if you have moles that are like this, you definitely need to be checked. So there are also melanomas that can be white or pink. It's very frightening. Dermatologists live in fear of those, but anything that's changing probably needs to be seen by a dermatologist.
How often do you recommend people have their skin checked for concerning lesions?
I like to encourage everyone to perform regular self-skin exams to check for signs of skin cancer. Half of melanomas are self-detected. Regular skin exams are important for people who are at a higher risk of cancer, like people with a personal or family history. This is why you need to see your doctor and have them refer to you a dermatologist if there are any concerns, because they can make individual recommendations as to how often you need to be seen.
That's really interesting because I actually know for myself that I noticed that the freckle on my toe actually got bigger. I was at the beach and I had like my feet under the water, was taking a picture of my feet, like my feet in the sand, all that kind of stuff, and realized that I was like, man, that looks bigger than I remember. And that's when I called Ashley, when I went to see Ashley, and I was like, I swear this used to be smaller. Like, I don't know if I hit it or whatever else, but honestly, it was just me noticing that freckle on my little baby toe had gotten bigger, tried to take a picture of it for another reason, which is crazy. So anyways, but okay. So let's say you're told you have skin cancer, Ashley. What are usual treatments that you're suggesting or discussing with your patients?
So there are several different forms of treatments for skin cancers. If we catch them really early, sometimes we can use even just a cream for them. We use light therapy. We can freeze them. The best way to treat most skin cancers is with Mohs surgery, which is what I do. It's a specialized surgery that I received extra training in. This surgery lets us remove all of the skin cancer cells for the highest cure rate, up to 99%, while sparing healthy tissue and leaving the smallest scar possible. But overall, it really depends on the depth and stage of your skin cancer.
Mohs surgery is so amazing. I remember being a medical student and a resident and shadowing in actually where the clinic Dr. Sturgeon works at now and watching them perform Mohs surgery and being just so fascinated by it. It's actually so amazing. And we're so thankful that that technology exists to do that. And that skill, that we have the skilled surgeons that can do that. This is why I have you see my patients, Ashley.
Well, thanks.
You've been diagnosed with skin cancer. You've undergone treatment. What is the prognosis or survival rate?
So this is what I love about what I do. Most patients do really, really well, especially if we catch this early. Basal and squamous cell carcinomas, which are the most common types, are really treatable if detected early and treated properly. The 5-year survival rate for people whose melanoma is detected and treated before it spreads to lymph nodes is about 99%. So patients do really, really well. But once it's spread to lymph nodes, the survival rate goes down significantly to 68% and then down to 30% if it's gone to other organs. So most skin cancer deaths are actually from melanoma. However, catching a melanoma before it spreads can be life-saving.
That's really interesting. Actually, I don't know if I'd ever told you this, Ashley, but I've actually diagnosed metastatic melanoma on a colonoscopy before.
Yeah, that's bad news.
In the colon, that biopsy, thinking, this doesn't look like my usual precancerous cancer lesion, but it doesn't look normal. And then came back as melanoma and basically didn't even know they had a primary source until the biopsy came back. It was crazy. It was one of the craziest things. And it looked very similar even in the colon, like kind of a brown spot that was just did not look right. And so it's just, I'll never forget that. I was never expecting to diagnose melanoma in somebody on a colonoscopy. And this is why early detection is so important, guys. Ashley, thank you so much for reviewing what skin cancer is, who gets it, how to detect it, how to prevent it, and lastly, what to expect if you are diagnosed. All of this information, of course, is so incredibly important for our listeners, but I won't lie, I'm really excited to talk skincare products. So let's get started.
All right, ladies, who doesn't love to talk skincare? I know I do, but I'm not going to lie. I hate wasting my money on products that don't work. I mean, some of those products are expensive.
I agree. I have a cabinet full of products and a folder full of face rash photos to prove my folly when it comes to skincare. I can't tell you the number of times I've sent Ashley a photo of me with a rash only to have her ask, okay, Carrie, what new product have you tried this time? I finally wised up and said, okay, what categories or products actually do anything? And maybe let's talk about some brands that might be your favorites. Now, I know a lot of this, but Dr. Sturgeon, what categories of skincare products do you recommend as must-haves?
Well, I tell everyone the best and really the best anti-aging skin cancer product on the planet is sunscreen. It's anticlimactic, but it's true. A zinc-based broad-spectrum sunscreen with SPF 30 or greater will get you a lot of protection. If you're in the sun, waterproof or not, it needs to be reapplied every 2 hours. And don't forget that skin cancer can happen on the lips too. You can apply a lip balm or lipstick that contains sunscreen with an SPF 30 or higher as well. Because kiddos are so susceptible, parents should avoid exposing little babies younger than 6 months to the sun's rays. Sunscreen use is supposed to be avoided in them at that age, so coverage and just keeping them out of the sun is the best. But remember that even on cloudy days, up to 80% of the sun's harmful UV rays can penetrate the clouds, so you really need it all the time.
So that's the secret to the youth, guys. We finally have it. Yeah. Sunscreen. But seriously, the better you are about applying it at a younger age, the younger you will look when you are older. I know that I've been really diligent about this. Like, I think when I finally turned 25, I got really into wearing sunscreen and, doing a lot better with my skin, making sure I stay out of the sun as much as possible. And I have seen a difference, even from being younger with the tanning bed stuff and all that the other things. So, Ashley, what brands of sunscreen do you like? Is there anything specific?
So the best one is the one you'll use. I think whatever formulation that smells good and feels good to you, that's easy to get a hold of is great. I like La Roche-Posay. I like CeraVe. I like ISDN. there was some garbage on the interweb at some point about sunscreen causing skin cancer, and this is patently false. Sun causes skin cancer. We know that people who are prone to skin cancer wear more sunscreen, and so that's what we would call a confounding bias, because that kind of research wasn't research. It was fake news, and it came out really talking about how people who wear sunscreen a lot grow more skin cancer. Well, no, people who grow skin cancer tend to wear more sunscreen.
Yeah, I feel like if we had another slogan on the show, I've told you what my first one would be. My second one would be correlation is not causation.
Yes.
I feel like
Absolutely.
so much of our time myth busting about things that get out there and they happen to have some correlation does not mean it's cause and effect. So I think that's really important in general. If you are listening and you are critically appraising any news or anything that you read on the news, keep that in mind because we see that all the time in medicine and it really scares people. I think it's important to know that. All right. I am loving this so far, Ashley, but let's talk about it. What about the vitamin D deficiency if I wear sunscreen?
Yeah, I do hear that a lot. Having an adequate vitamin D level really relies on a well-rounded diet. And the idea that you can only get it from sun is really not true. My vitamin D level is normal and I get like zero sun getting through to my skin. So vitamin D from food and supplements is absolutely adequate. Good food sources include fortified milk, yogurt, cereals, oily fish like salmon and tuna. Most women should be taking a calcium and vitamin D supplement, but talk to your doctor before you start supplements over the counter.
Absolutely.
As a primary care physician who does routinely check a lot of vitamin D levels in appropriate settings, I see so many low vitamin D levels. And the first thing people say is, but I spend so much time in the sun. And I'm like, well, your vitamin D level is low. Your A1C is high. Your cholesterol panel is also high. I think we need to look at the other reasons why your vitamin D level is probably not appropriate. And it's not the sun. This has to more do with a diet. But let's cue the drum roll. Ashley, what is the product number 2 that we need for our beautiful skin?
Great. So the next best thing is a vitamin A cream. Retinol is another name for it. Retinols train the skin to behave better. There are over-the-counter options. A prescription is also available. It lasts a long time. It's worth the money. You use just like a pea-sized amount for your face, and you need to use it for several months before you see a change. Pro tip, anything that says clinically proven means it was given to consumers to try, not that it underwent clinical trials with approval from the U.S. Food and Drug Administration.
Ooh, that's a good tip.
Yeah, love pro tips. I mean, we definitely all see that on advertising, and our listeners are going to be the most well-informed people out there. Are there any over-the-counter vitamin A brands that you recommend? I know you mentioned prescription was your preference, but I'm just curious.
Sure. Well, this kind of goes back to the sunscreen thing. Like, what will you use? What do you prefer? What smells good? What feels good? What can you get a hold of? Because to me, where's the science? There are no randomized controlled trials comparing over-the-counter vitamin A strength. So really the prescription is the one that I know will work.
I absolutely love the Retin A cream. I don't think I discovered that until just like about a year ago. And it does take a while. Like that's what we need to make sure everybody knows is you don't just try it for a couple of weeks and see no difference and you throw it away. It takes, 3-6 months or so, and you will actually see these huge differences in your skin. The question that I have for you, can we use Retin A when pregnant or breastfeeding, especially for a lot of our women who may be curious about that?
Sure. So I, as someone who also suffered with infertility, I don't do vitamin A during pregnancy. Getting extra vitamin A during pregnancy is not a good idea. And I don't really think it could be absorbed that much from the skin, but I don't recommend that patients use it when they're pregnant. I like for them to use over-the-counter azelaic acid. It is safe in pregnancy. So that's usually what I recommend for pregnant people. But actually, in baby vitamins, there is vitamin A. So once a baby's outside of your body, their neural tube is developed, and that's the concern with vitamin A during pregnancy. And so really it's probably fine during pregnancy, but I chose not to. And then as soon as that baby came out, I breastfed and used vitamin A cream.
Ooh, so I'm excited. I can get back
There
on
you
my
go.
Retin A.
Very soon.
It reminds me, I need to get a prescription from you, Ashley.
Oh, yeah, for sure. So we've got sunscreen and vitamin A or the retinols covered. Any other secret sauce out there that really works that we need to know about?
So we've got pretty good data on vitamin C. Vitamin C is an antioxidant that can slow early skin aging. prevent skin damage, improve the appearance of those wrinkles, dark spots, and acne. It also fights the harmful free radicals that are created by the sun, or toxins that come into contact with your skin from air pollution.
I love and live by my vitamin C face cream. It smells like oranges and I
Mm.
love putting it on. I do like my moisturizer, my vitamin C, and my sunscreen. And that just gets me started for the day. I feel bright and ready to go. And I definitely have simplified my regimen as I've gotten older, thanks to you, Ashley. Are there any over the counter vitamin C cream brands that you favor necessarily?
So I think one of the most important things is to look for the container because vitamin C is an antioxidant, so it is oxidized easily. That means it is rendered useless. So whatever topical you use needs to be in a dark, light, impenetrable container. But again, no randomized controlled trials comparing these. So honestly, who knows? Stick with the one you feel good and smell good with. Yeah.
Hmm. Okay, so now that we've talked a lot about topical anti-aging treatments, what about more invasive anti-aging treatments like Botox, fillers, lasers? Do they work? Is it all a scam? Who should use them? How should they be used?
So they definitely do work. I think these are good things to spend money with. Botox, botulinum toxin works for frown lines, crow's feet, forehead lines, and even excessive sweating. We've used Botox, especially Botox brand, medically for really since the 70s and 80s. So we know that there is a study that showed that women who received Botox at a younger age had better skin quality under the microscope at an older age. So you see Botox when we inject botulinum toxin. There's several brands other than Botox. I also use Dysport quite a bit, but they're both the same or similar botulinum toxin. When you inject it, it paralyzes the muscle within 1 to 2 weeks, and results can last 3 months. So with fillers, you get instant results. We use these to add fullness to the cheeks, work on scars, fine lines, and plumping lips. They can also help lift the brow or a downturned mouth. Some people use it on hands as well. I really like it in the hands. There are several different brands. Juvederm and Restylane were kind of the originals, and these results usually last 6 months to a year. I love IPL or intense pulse light therapy. Great for kind of the regular patient who comes in with fair skin, especially having sun damage with light brown spots or mild redness. I do love CO2 laser. It is more aggressive, so it kind of does resurfacing of the skin, helping with these fine lines and wrinkles. I really love it. You got to have some downtime with that one though, because you look rough for several weeks.
I really should have called this episode just a few of my favorite things, as I am pretty sure I have tried all of these treatments for my own pigmentation and fine line. I had the issue that after, strangely, not while pregnant, but after delivering my first son, a lot of brown spots, sun damage, all of that goodness started popping up out of nowhere. And I remember going to see Ashley about it, and we tried light therapy, we tried topical creams, and all of those things. So absolutely, I can attest that they definitely do work. Now, I know they're not for everyone. So we're not saying that you need to do these things if you are super anti-invasive therapies. We've given you suggestions for some other things that you can use. Absolutely, that you will see a difference. And no worries. We just want you to have the facts so you can make an educated decision for yourself. Now, switching away from anti-aging a little bit, what are your preferred skin creams for, say, just a rash or irritation or even just dry skin?
I love, love, love petroleum jelly Vaseline. It's the best thing ever for all the things. You can put it anywhere. Occasionally, it can cause acne, so I don't really love to use it on my face, but I do love to use it on my eyelids when I get dry and itchy rashes there. Sometimes my retinol will travel a little too far onto my eyelid, and Vaseline is the cure for that. So Vaseline is really preventative for eczema. I love it in little tiny babies. Really keeps them, it prevents them from getting itchy, and heaven knows we want them to sleep as much as we can, right, Dr. Gray?
What's the difference between using Vaseline and Aquaphor?
That's a good question. I love Aquaphor, and Aquaphor is a great product unless you're allergic to lanolin, which is an active ingredient in it. And lanolin is one of the 80 most common allergens that we do allergy patch testing for. So lanolin is contained in Aquaphor. So I tell people just to go the cheap way. And I like to be cheap on products so that I can spend money on Botox. But I think Aquaphor is great as long as you're not allergic to it.
Yeah, that's good to know because I lather my son in Aquaphor and he doesn't have sensitive skin, but I will lather it on him, on his face especially, and it keeps his skin so soft and so clear, even since he's been little. I've just gotten in that routine of it. And then I just lather it on my hands, so the backs of my hands and tops of my hands whenever I use it too. And it just makes a huge world of difference with your hands, especially being healthcare workers where we wash our hands 100 times a day. And so just adding that very small, like I don't use hand creams. Like people will give me hand creams and all sorts of stuff and very nice, fancy smelling ones. And it's just honestly, the Aquaphor has just been more effective at penetrating the skin and keeping it soft than any of the fanciest hand creams I've ever been gifted or spent money on.
I 100% agree with that statement.
So I've kind of always been a big user of both, although I think it's funny. I think after the third or fourth time of asking Ashley about my rashes, when she said Vaseline, I was like, all right, I'm not going to ask anymore. I know the answer. Give me some petroleum jelly, but I have always had extremely sensitive skin. And so the littlest thing will set it off. So unfortunately, I've never been one of those people who's able to go to Bed Bath & Beyond and get those fragrance, I've had to use fragrance-free everything since the beginning of time. And my poor kids are pretty much the same way. They're like, never get to have anything smelling good. But I love both of those products. Like you said, for kids, especially in where we live, it's very dry, and so you kind of really have to stay on top of it because it so easily gets dry here and we get dirt and everything else. And both of those have been great products. And I'm super glad that our answer is something that's going to be very affordable for everyone listening.
Yes, I counsel my patients quite often when they talk about their eczema or their dry skin not to be using the Bath and Body Works smelly stuff, not to be using the things that have so much alcohol in them, which is what puts the perfume smells that smell wonderful. But if you're actually using it for a treatment of a skin issue, dry skin, eczema, you do not want it to have a floral, lovely smell. It should smell bland like nothing, or, sometimes it's just, maybe it doesn't smell the best of all the options, but Aquaphor, CeraVe, all those great ones are awesome, but they don't have these smells because they're good for sensitive skin, but they actually have a purpose. If you're just wanting it to smell nice, and, I have a Bath and Body Works hand sanitizer or hand wash here and there that smells great, but we're not using it for a medical purpose. So I'm going to make sure I have all these products in my cabinet immediately. Dr. Sturgeon, thank you for coming on the show today. We have loved chatting with you.
Well, it's my pleasure. Thanks for having me.
Skin cancer, the most common skin cancer in the United States. You know now what it is, how to identify it, prevent it, and how it is treated.
It seems the fountain of youth for your skin really does exist in the form of sunscreen. We've told you the products and treatments our favorite dermatologist recommends, guys. Remember to like this episode, subscribe, turn on those notifications for new episodes, tell your friends, and stay tuned.
Thank you for listening to the MedEdit podcast. Please click the follow button to be notified when new episodes become available. For more information about this episode, and to learn how you can reach Dr. Carrie Sorrell and Dr. Jessica Gray, please visit today's show notes. And don't forget, click that follow button to be notified when new episodes become available. The information and content has been made available for informational and educational purposes only, and does not constitute a physician-patient relationship. If you need medical advice or help, contact your personal physician. The views and opinions of the guests do not necessarily represent the views or opinions of Dr. Jessica Gray and Dr. Carrie Sorrell. This podcast should not be considered as an alternative for medical advice, diagnosis, or confirmation of an illness or disease. Please seek assistance from your personal health practitioner.